The House Appropriations Subcommittee on Health and Human Services is called to order. Clerk, please take the roll.
Chair Morse,
Here.
Representative Martis, Representative Hood, Representative Braybeck, Representative O'Neill, Representative Purry, Representative Farhat, Representative Price, Representative Skaggs,
Here.
Representative Snyder,
Here.
Representative Green,
Present.
Representative Bolin,
Here.
Representative Meerman, Representative Kuhn,
Here.
Representative Steele. Madam Chair, you have a quorum.
Thank you, Clerk. Rep. Skaggs moves to approve the minutes of February 28th, 2024. Hearing no objection, the minutes are approved. Welcome, everyone, to the Health and Human Services Appropriations Subcommittee. Today, we are pleased to have multiple presentations regarding our child welfare system, a system that is really so critical for us to fund properly and get it where it needs to be. It was not really getting the attention that it needed for many years, so we're happy that we're working on this turnaround, and we look forward to having everyone testify on the current state and what the needs are. So with that, we welcome Senior Deputy Director Demetrius Starling of the Children's Services Agency and Amy Epke, Senior Deputy Director of the Financial Operations Administration. Welcome.
Good morning, Madam Chair and esteemed committee members. First and foremost, Madam Chair, I appreciate those kind words. To have someone, allies on these groups in regards to child welfare systems and programming and monies and resources necessary for our vital programs really means a lot hearing from you, so I thank you for that. So first off, I want to start off really kind of going over our Keeping Kids Safe agenda item. And this is work that's been spearheaded by Director Hertel, really trying to lift up the basic tenets of our work and how we plan to keep children and families safe in the state of Michigan. So there are 5 paramount pillars that we really want to highlight today. The first is prevention. And I want to talk about some of the underpinnings of the work in regards to these 5 pillars. So under prevention, we are investing millions of dollars to create more family resource centers, allowing Michigan to become one of the only 5 states to receive the Child Safety Forward grant from the Federal Office of Victims of Crime. This project focuses on reducing and preventing child deaths that result from crime. The number of family resource centers recently expanded by 5 for a total of 5 in local communities. In our family resource centers, we work with families that are at risk of abuse and neglect to meet their needs sooner than later and strengthen their protective factors. We're also looking to improve the process for handling reports of suspected child abuse and neglect to the state's toll-free hotline by creating a structured decision-making tool that better guides our frontline staff. We've also developed firearm safety protocols to provide guidance for our child welfare staff to talk with families about firearm safety. This includes creating a website with information about where families can get free trigger locks and appropriating $2 million to support initiatives related to misuse of guns, including trigger locks and other available options. We've also expanded home health nurses and other professionals to proactively identify and help families who may benefit from better parenting strategies and coping skills. We've also piloted a vulnerable child protocol in various counties that provides additional safety reviews of cases in which the child has bruises and is too young to fully speak for himself or herself in those instances. We've analyzed our data in partnership with Chapin Hall at the University of Chicago to determine which families are most at risk so the department can provide services sooner for the well-being of our children. Under intervention, we've developed an intervention tool that requires regular communication with caseworkers and their supervisors during key points of an investigation. We've worked with our stakeholders, some here today in the gallery, and partners in the legislature to support the child welfare system through identifying policy changes to increase child safety. Some of these changes include improved data sharing between behavioral health, substance use disorder providers, domestic violence providers, and the child welfare system. Learning more from these child deaths by participating in multidisciplinary child death review teams also includes MDHHS, prosecutors, law enforcement, medical professionals, and other enforcement medical professionals as well. Under stability, we've established regional placement units that help identify appropriate living arrangements for youth to ensure that they are in the most family-like setting or settings that can best meet their treatment needs. We've created the Bureau of Children's Coordinated Health Policy and Supports within our department to improve and build upon coordination and oversight of children's behavioral health needs and the services and placement of children with very complex needs. We've also created an executive committee that provides support and accountability to service providers in the child welfare system that are not meeting expectations. This committee provides an opportunity for leaders in various administrations within MDHHS to holistically review the work of agencies and recommend interventions to our child welfare system into child safety. We've also looked at different ways to hold child caring facilities accountable and limiting the use of dangerous restraints in our state. We've launched ChildStat, which is a quality improvement process to make systemic changes to the state's child welfare system. ChildStat strategies include providing support for relatives so children can be placed with them instead of group residential facilities. We've also developed a pilot program to embed one of our eligibility specialists with our child welfare teams to more easily provide immediate support to our families as needed when there are economic or concrete supports evident. Under wellness, we've increased funding for stronger basic needs to ensure families have access to adequate food, housing, and utilities. We've increased access to quality mental health services to help families meet their needs. And we implemented a pilot project to work with local community health agencies to connect our families with mental health services as soon as children enter foster care. Under workforce, we've implemented proven training practices known as motivational interviewing that can provide all of our child welfare staff with enhanced engagement and assessment skills. Motivational interviewing is a new technique to encourage more engaging questions and allow for enhanced information sharing with the family, which can help identify the appropriate services and support for the families. 49 counties have trained so far, and we're expanding on a monthly basis. We've also improved the quality of ongoing safety planning, training for child protective services workers and supervisors. Our safety planning includes actions that families and people who support them are willing to take to prevent or respond to child safety or risk issues. We've also developed an ongoing quality assurance unit focusing on providing independent feedback to investigators to improve investigation quality. So these are just a couple things that we are very proud of as a department. We're lifting up, and we appreciate the support that we receive from the committee members in these particular areas. Next, I just want to provide some data in regards to children's services in our child welfare system that we have within the state of Michigan. So as you all know, we have 83 counties. We have 5 business service centers that are manned by 5 regional managers. We have approximately 2,797 child welfare workers, and we contract with 58 agencies to provide family preservation, foster care, licensing, and adoption services. And as you can see, I'm not going to go over all the numbers here, but one of the things I really want to lift up, because it's a strong process or tenet for us right now, is prevention. We're really proud of some of the prevention work that we all have in flight right now, and as we all know, that if we can meet families where they're at before they come to the attention of foster care or CPS, we believe that our families will be much better off. So right now we have 772 open and active prevention cases, and of those, we also have Title IV-E prevention cases that are servicing 74,615. So this is really important for us, again, to continue to showcase and spotlight the importance of working upstream, working with our families from a prevention perspective so they can hopefully be diverted away from other child welfare systems. Next, I want to take some time to talk about what we all know to be quite evident across multiple disciplines, not only public but also private. So recruitment and retention of staff continues to be a concern for us, but we are addressing it steadfastly. Some of the challenges that we have right now is that we are at a 26.8 turnover rate in fiscal year 23. And part of that, there are a couple of things. The high acuity of cases, the complex cases that we have for our child welfare staff, really outweigh or just don't really mirror some of the cases that we've seen in previous years. Staff are emotionally burnt out. The casework is truly demanding. There are sometimes unpredictable hours due to the complexity of the cases and the high workload that our staff continue to see, again, not only in public but also private agencies as well. Some of the efforts that we have put forth so far is to work with our Title IV educational program partnerships with different universities to provide bachelor's and master's degree to our social work students with stipends for tuition and educational expenses. So our students are required to work in child welfare for a specified period of time for those stipends to be enacted. We also have continuous mass hiring efforts in partnership with other civil service and other child welfare professionals. I routinely do, check-ins with, my folks in state-ran facilities and also local county offices. Folks are being very innovative in regards to how they do community outreach. So going to the local colleges and universities, working closely with their social work and criminal justice departments to see if there's a way that we can recruit young adults to come to our department, but we're also working steadfastly to look at different models where we can work with high school students as well. We want to start as early as possible to see if we can recruit folks to the department to do this much needed and necessary work. So next, I want to take some time to talk about our placement array. And these are things that we're really trying to uplift and also really step up our processes in regards to recruitment of these particular homes. So Respite is a statewide program intended to provide temporary, occasional relief to foster parents and relative caregivers. The Respite program allows for families to choose their own respite provider or be connected with a respite home through our regionalized respite contracts. Regionalized contracts will include services for foster parents and unlicensed relatives, providing placement for out-of-home wards, as well as families who qualify for post-adoption services. Under community reintegration home programs, a community reintegration home is a licensed foster home contracted to provide a family-like placement for youth who are being discharged from a child caring institution without an identified long-term community placement. A youth may remain in a CRH home for a sufficient time to allow for successful transition back into the community. The purpose of the CRH is to provide a family placement while more permanent placement options are being researched and identified and assessed for services needed to maintain the youth in the community. CRH placements will allow a youth the opportunity to reintegrate into the community in the care of experienced foster parents who specialize in this type of placement. There are currently 5 CRH foster homes with a goal of 20 CRH homes to be contracted statewide this year. Under kinship care, a federal rule change allowed Michigan to move away from relative licensure and towards a relative approval process. The relative approval process will become mandatory for all relative placements as of March 4th, 2024. In addition to being an easier process for relatives than licensing, this will have significant budget implications or impacts, allowing for Title IV claiming for maintenance payments for all new relative placements, including admin costs. To continue to expand relatives and kinship supports, a proposal to reinvest these savings was put forth. The proposal would impact relative supports, the Kinship Advisory Council work, and the expansion of existing programs. Under IOP programs, we've added a service type and services for pregnant and parenting programs, which includes transportation, supplies, parenting supports and education, medical appointments, increased transportation, and enhanced staffing. We've also added an overnight shift differential. We're looking to match direct staff salaries to CCI salaries. We'll also incorporate a startup and emergency food supply cost. We've updated our referral and intake process, and we've increased our trainings and supports. Additionally, managers and analysts in children's services routinely have discussions with our private agency partners, contractors, and other community partners. During the past 3 years, these discussions have included upcoming changes, such as contract language, building the case management module in CCWIS, and updates to our policy and developing practice guidance in our foster care and adoption advisory meetings. To help Michigan understand our unique needs and develop targeted campaigns, Children's Services also recently hosted a 7-part training series on targeted foster home recruitment, presented to the private agency partners and MDHHS and adoption staff by Dr. Denise Goodman, a national expert in foster family recruitment. Next, I just want to touch on our child caring institutions. So currently we have CCI contracts or child caring institution contracts with 8 agencies for juvenile justice services and 26 for abuse and neglect. We also, of course, as many of you all know, have launched our residential collaboration and technical assistance unit, which provides very concise oversight of our child care institutions. So this consists of over-the-shoulder support, our folks actually going, having boots on the ground and going to the facilities and offering support and guidance and also training to make sure that whatever issue or concern they have is alleviated, and we have some really sound strategies and remediations in play. We also partner with 34 providers across the state and average support for 459 children on a daily basis. Next, I want to speak about our access to behavioral health and some of the things we have in flight. Inpatient behavioral health and psychiatric treatment capacity is being bolstered within our congregate care settings with the addition of our new psychiatric residential treatment facility, which is PRTF, and intensive community transition systems, which is ICTS beds. An Institute for Medical or Mental Disease, which is IMD, exclusion from mental health treatment waiver, is under development, along with active expansion of the existing qualified residential treatment program. The department also is implementing a standard behavioral health screening and assessment tool, better known as Michicans, to ensure treatment needs are identified and appropriately considered when developing treatment plans and assessing placement options for our youth. So next I'm going to hand it over to Amy. So she's going to provide a little bit more context in regards to our fiscal year 25 executive budget investments and keeping kids safe.
Good morning, Chair Morse and members of the committee. I'm Amy Epke, Senior Deputy Director of Financial Operations, and thank you to Demetrius for touching on a lot of the initiatives underway in the child welfare space and the positive approaches that we've taken. What I'm going to talk about are 3 investments as we continue to focus on keeping kids safe into the future. The first investment included in the fiscal year 2025 budget is related to the Modified Implementation, Sustainability, and Exit Plan, otherwise known as the MISAP. This is related to a 15-year-old lawsuit in the child welfare space that's before the federal courts. In 2019, there was a joint plan that was submitted to the federal court, including 74 provisions. The provisions included performance metrics around investigations, safety, placement, and permanency. Earlier this year, the court accepted a new agreement, taking the number of provisions from 74 to 23 due to the progress that has been made to date. The proposed $10 million in the budget would allow us to continue to implement the final benchmarks included in the MISAP. The second initiative included in the budget is $38 million for the child caring institutions. Child caring institutions provide care for children in foster care and in juvenile justice, providing 24-hour care within those institutions. In the past, we've had a number of contracts in place. In some cases, we've had more contracted beds than we've actually had filled beds. Yet we've had some gaps in terms of services. So what this $38 million would allow us to do is work closely with providers to restructure the contracts to provide predictability in their funding within the contracts and making sure we're aligning the appropriate services with appropriate areas as we move forward. The third investment is around the clothing and holiday allowance, and there's $1.5 million general fund included in the budget. Currently, foster care parents receive an allowance for clothing and for holidays. The allowance has not been increased in 20 years. The clothing allowance is paid twice a year and is currently at $75. The payment would increase to $150 with this proposal. The holiday allowance would increase from the current allowance amount of $25 to $75 a year with this proposal. So these are three of the initiatives around the child welfare space. Certainly there are other initiatives included in the budget that touch on keeping children safe, whether it's some of the housing initiatives or some of the things we talked about related to community violence efforts as well. But at this point, we can certainly open up for any questions that you may have.
Thank you so much for your presentations. It is really gratifying to see, you know, all the intentionality around all this work that you're doing. I have a couple questions, but I'll let my colleagues start first. Vice Chair Green.
Thank you, Madam Chair. Thank you for being here and for all the work that we're doing to get out of the court oversight. So I have two questions, sort of a follow-up. Okay. Inside the contracted beds that you guys have just talked about, I know from what sources I'm hearing, we've had several institutions close their doors, and that's putting a strain on the backlog. I think the Wayne County juvenile detention system is over its limit, and so we're trying to push it out, get these backlogs out, and I got to get to my in the contracted beds. What are the numbers you're looking at? And is that inside the contracted part, and is that like an increase or a decrease over what we're currently doing to get some of the backlogs, specifically the Wayne County situation?
Yeah, we're still working through final numbers, but roughly we're looking at contract amounts between the 550 to 600 beds. We have currently had upwards of 700 or even more, but again, those haven't been filled. We've been typically filled closer around the 450 level with then a wait list as well. So we want to make sure that we work closely with the providers to get that number right. And then once we have that overall number right, also work with them in terms of what the appropriate amount is that they can support moving forward as well.
Okay, so from the budget presentation, that's still we're still massaging that line item?
Yeah, it's roughly in the 550 to 600 level, but we'll continue. We need to have more conversations with providers on that number.
Okay, and a second question. Reading the proposed budget, there was 21 FTEs and roughly $12 million for White Pines and Shawano. What's the breakdown for usage of those dollars?
Yeah, so in terms of the juvenile justice piece, there's two other components I didn't touch on in here. There's $6.9 million of ongoing funding and then $5 million of one-time funding. The $5 million of one-time funding would go directly to Shawano and Bay Pines for infrastructure upgrades, whether that's bathrooms, perimeter fencing, unit upgrades, and things like that. And the ongoing funding, as you mentioned, there are the 21 staff included. 15 of those would be for Shawano and Bay Pines, and then there would be 6 for juvenile justice reform efforts.
So we're not expanding our bed footprint, we're just doing capital improvements and then adding more staff?
Correct. I'll have Demetrius talk about where we're at in terms of capacity. I don't know where we're at currently at capacity for those two facilities.
Right, so at Bay Pines right now, we are currently fully staffed. So as Amy stated, most of these capital investments are for, really the upkeep of these facilities. Shawano it's a different challenge in itself, because of the region, they have some difficulties in regards to recruitment and retention of staff there. So right now, we are down 6 staff and looking to enhance some of our staffing there to bring on a psychiatrist, to bring on a nurse for the youth there, a program manager. So some of those FTEs will go to that as well. Yeah. And once those staff are hired, that will help us in the ability to build our capacity as far as the census of our children there.
But we're not looking to expand the number of beds?
Correct.
Okay.
Yeah.
Thank you.
Representative Steele?
Thank you. I appreciate the report, and I appreciate us trying to help the child welfare of our children of the state of Michigan. And I'm not really sure if this is even directed at this presentation, but it is about the child welfare and more of their mental health. And maybe this is more directed towards the chair of this committee, is that hoping that we might be able to have a report of our psychiatric hospitals as well, as they have hit the news most recently, and maybe we can have an update in the near future about how those beds are and how those facilities are being run and how they're being staffed and funded. I think that this committee would like, probably, I know I do, more information about that, so maybe that's something that we can look forward to in the future. Thank you.
Rep. Steele, we are doing a committee hearing on behavioral health in the next few weeks, so we can ask some questions then. You're welcome. So I would like, if you could, a little bit more detail about the MISEP, the 10 million for MISEP. Can you be more specific about what specifically you're trying to address and what those investments would specifically be used for?
Within the MISEP, there's a number of really specific provisions around like permanency rate and safety and things like that. So as we continue to work with the court, we're working on what would meet those acceptable standards. So in some cases where we have to increase the permanency rate, we may need to have dedicated resources to help in those specific regions, to work with those regions to make sure we can update the permanency. So a lot of it is specifically tied to the provisions in the MISEP, as well as the continual conversations with the courts on what is acceptable.
Rep. O'Neill?
Thank you, Madam Chair. Mr. Director, Deputy Director, thank you for your information and the work that you do. It's not an easy task to facilitate this transition across the state of Michigan. I understand that. I want to just kind of point to the Children's Services Administration category on page 3 of my slide, under the juvenile justice block there. You referenced that also on page 4. But just a couple of questions in terms of, you indicated we lost oversight of our ability to kind of oversee these locations. Is that correct?
I'm sorry, I didn't hear the last part.
I think I took notes that you said we lost oversight, our ability to make oversight or have oversight over a lot of these facilities.
We've increased our oversight. So through RCTAU, which is our Residential Collaboration Training Assistance Unit, that was a unit that was formalized specifically to help with any kind of issues that the facilities may have, whether it be training, leadership.
Okay.
Yeah.
All right. So just another question. I know we have limited beds, as you said. So with that number being as it is, what are some of the efforts the department is taking to try to reduce the number of children who are, lack of a better word, just maybe sitting or waiting in many of our county CCI facilities? For example, you got a child, kids, 15, 16-year-olds, they do make mistakes, get caught up there in the system. Many of our kids don't have family support. We know that. However, some do. So in contrast to the ones that don't and the ones that do, what are some of the things that the department does to try to mitigate reunification? I know that's a part of your mission. Our mission is to, in best case scenario, if we can, we try to mitigate and reconnect those children with their families. Mm-hmm. Can you elaborate a little bit on that, sir?
Yeah, no, good question, Rep. O'Neill, but I want to make sure that I'm tracking you. Are you speaking specifically on JJ or just our child welfare system? It sounded like you were going down the road of JJ.
JJ.
Yep. So as we noted yesterday in our presentation, a couple of things that we're really trying to enhance through our JJ recommendation package and also through some work that's being done by Aaron House within our department, is that we're looking at different ways for diversion. And, one of the things that's been truly amazing to see in flight is the work that we have in collaboration with some of our local county judges and also stakeholders to look at different ways that we can intervene in the lives of these young adults before our systems even touch them. So looking at different, more robust array of placements for our youth, whether it be, looking at community reintegration homes for kids who've already been in our systems, but on the front end, prevention is really the key. So, if that means that we need to have more probation officers or have more teen support programs to keep kids out of our systems, we're going to look at that. Again, our mantra has always been for the last several years to not only just think about why kids are in a system, but kind of work upstream to find out what some of the barriers or challenges are. So looking at things like team wellness and how we can enhance that in Wayne County, looking at different programs such as day treatment, night watch programs, so kids don't have to go to our JJ facilities altogether, are things that are really important and paramount for us to keep kids out of our JJ system.
Yeah, I appreciate that, and I really, from my space, again, I keep saying this in different committees, I chair corrections. And I have extensive background in family reunification with federal halfway houses. I used to run halfway houses in Detroit, Grand Rapids, Texas, and Mississippi, and Saginaw. So I've seen the importance of transitioning, those returning citizens back with their families, but also in the juvenile justice system, being a mentor for foster kids in the state of Michigan. And so when there's an opportunity, my point is, when there's an opportunity that we as a state of Michigan can facilitate the reunification of those kids with their families, with supportive families, I would hope that we take really aggressive, proactive activity and figure out and try to see where there's a way we can do that to kind of reduce the load of not having spaces in places like Vista Villa,
Vista Maria.
Vista Maria. I think they have a waiting list right now. And so when that happens, our kids are just sitting, and many of them have bright futures, but given the opportunity, I think, they can reintegrate themselves back into their youthhood and society and get back on track. We've all had missteps in life, as you know, and at some point in time, somebody helped us. We didn't get here on our own, none of us, okay? And so my advocacy side of me is always thinking of how can we, if there's possible, work to get that family back with their child, okay, in this breath. So thank you, Madam Chair.
Yeah.
Thank you.
And Rep. O'Neill, as always, I just want to say thank you again for, just being such a strong advocate in this realm. I think it's important, again, for us to have allies in this work, especially for those youth. As we stated yesterday, juvenile justice is really kind of turning the corner with us. We're looking at different ways to not be as punitive as we've been in the past and have this sense of restorative justice. So we have some really good partnerships and collaborations with key stakeholders across the state, and even from a federal level. We just met recently with OJJDP. They've come in and given us really great advice, and it's free, as far as how we can improve our juvenile justice systems in Michigan. So I appreciate you and your support.
And we will be having a hearing on juvenile justice coming up as well, so we'll get more information then. Thank you.
Yep.
Rep. Meerman.
Thank you, Chair Morris. I wondered if we could expand just a little bit on, expanding relative and kinship efforts. There's some pilot programs going on. I think there's proposed pilot programs. And then along with that, what does it look like for a relative to be, I understand it's not licensed, but, what are the steps they have to go through? I'm supportive of this effort.
Yeah, we can make sure we provide the committee with the full approval process so you can get a better understanding or glimpse from a policy and practice perspective. But to your earlier question in regards to what we're doing with kinship care, we have, of course, the Kinship Advisory Council. We're also working with Chapin Hall and also ACF, our children's, our federal children's federal bureau unit, to really talk about how we can provide more support on the front end for our relatives, whether it be economic or concrete supports, whether it be more training. So this is really something that's very paramount for us. We're really trying to move towards the family well-being model where our kinship care providers feel just as supported as our foster parents. So rest assured, that's something that's extremely important to us, that we're going to continue to build on some of our processes that we have in place. But we can make sure that we get you all the process for the licensing, the kinship care approval process sooner. Okay.
And next, we have Rep. Hood.
Thank you, Chairwoman. I've been serving on this committee for a few years now and continue to have an interest in how we properly support our childcare workers in the career paths that are necessary to make sure our kids are safe. And I'm curious to know, lost my place. Don't need the cues. In any case, how are we coming along on wages overall? I know since we have invested in behavioral health in the school aid budget, we've seen some movement from the DHHS, CMH systems, and employees choosing to go into school districts. What then is the outcome in the CMH system, and how might we be partners in helping you to address the shortage of workers?
Workforce is something that definitely is at the forefront of our mind. We have taken some efforts in terms of wage increases in various areas on the behavioral health side. I think there's more we can still do. And for example, even with the CCI contracts, we're looking at some potential contract language that would require a minimum wage included in that to make sure that we're able to support workers. But certainly, I think there is more we can do, and would be happy to discuss any ideas that this committee may have as we go forward.
I just have one. I just wonder if you can answer real quickly, because we're always running out of time in this committee. You mentioned identifying families before they're really part of the system. Can you say briefly how you're going about doing that?
Yeah, thank you for that. That's a great question. So in some instances, we have families that have been a part of our systems or impacted by our systems. So we do the genealogy, we do, the tree with all the connected potential family members, but we're also doing a lot of listening circles with our lived experts groups. So making sure that we have this connection with the community that's fortified more so than we've seen in the past. So reaching out to our faith-based initiatives, people who are best situated in the communities that can give us a better understanding of how we reach our families at a sooner time in intervention before CPS gets involved. One of the perfect examples of that is a new pilot that we're launching later this year called I Care for Children. So we're working closely with faith-based leaders, educational professionals, again, folks who have boots on the ground, who know the challenges of their respective communities, and giving us some ideas on how we can reach the folks in the community to be foster parents, to be relative caregivers, if they know that there's a need in those respective communities. We have, some esteemed steering committee members, such as judges. We have Judge Braxton in Wayne County. We have different really high-level pastors and preachers in the Metro Detroit area that have been a part of our initial steering committee. And again, we're trying to launch that later on this summer. Hopefully, we can get some support from yourself, Madam Chair, and the rest of the committee in regards to that particular initiative.
Well, thank you so much. That's really exciting to hear about the community connections you're trying to, continue to establish and have the community really give feedback on how best to serve their residents. It's really critical to doing the work right, I think. So thank you for your dedication to the child welfare system, and we really appreciate you being here today.
Thank you, Madam Chair.
Let's see. And next we invite up some of our partners in the children's services area, including Dr. Dan Gowdy, President and CEO of Wedgwood Christian Services, Rachel Sykes, Executive Director of Legacy Adoption Services. Mary Mullett, Chief Executive Officer of DA Blodgett. Just make sure you turn on the mic, and the floor is yours.
Thank you, Madam Chair, and Vice Chairs Martis and Green, and all the committee members for having this opportunity to share, and especially my Representative Hood from District 81. Thank you. My name is Dan Gowdy. I am President and CEO of Wedgwood Christian Services in Southeast Grand Rapids and Kentwood. I'm also here representing ACFA. ACFA is the Association of Accredited Child and Family Agencies, which comprise of the full continuum of care, foster care, adoption, residential treatment, mental health, and even childhood services. So all of my colleagues here, along with the department and the CMH Association, we're just grateful to have this opportunity to share insights. What we believe about the Michigan child welfare system, how we might stabilize and refocus. You heard some of those ideas, and to combine our resources, both public and private, and to do what we all are here to do, to affect the greatest outcome for youth and families. I'm going to reference this infographic. If you could pull it out here, that would be great. And I think we might have the opportunity to share it on the screen above you. It's titled Michigan Child Welfare Continuum, Michigan Child Welfare Continuum. I'm referencing this, and I think it provides a pretty good overview. I'm going to be talking, at least in general, on some big, broad strokes. You know, if I was Bob Ross, I'd have the big brushes out and making the big, broad, bold strokes here, and then my colleagues will provide much more detail and much more clarity with that. My brief comments will be focused on this continuum and some key inflection points that I want to highlight. There are three, from the appropriations item, there are three appropriation lines that fund the majority of child welfare. They are the foster care payments, adoption subsidies, and the child care fund. The graphic in front of you shows the major types of services provided within Michigan's child welfare services. The blue and orange bar underneath some of the boxes represent what portion of those services are provided by public and government agencies and which portions are provided by private nonprofit organizations. The public is in blue, the private nonprofit is in orange. There are two critical inflection points within this full continuum that I believe and research is dedicated to have a lifetime societal impact. We understand life and we understand the precious value of a young life, but there are some real lifetime societal impacts that Representative O'Neill talked about and briefly that I think really matter most than others within the system. You'll see on the upper left-hand corner 3 boxes in the upper left that identified as in-home services. They represent a major opportunity within the system. We talked about just now with the Demetrius, Director Demetrius, the family preservation diversion programs matter a great deal. A 2019 study identified that when a youth is removed from the family and placed in the system, there is a lifetime societal cost of $119,000. This is compared to other youth that is able to remain in the home, even a home where that home maybe was the cause of that abuse and neglect. It's really interesting. So these costs they can include future earnings potential, likelihood of substance abuse, medical and mental care, as well as teen pregnancy. And if you look to the right of that, in-home services to out-of-home services, you'll see foster care and child care institutions. And the primary success for the continuum in the out-of-home services is dependent on these two groups, foster care, child care institutions. I'll refer to child care institutions, CCIs, you might have seen, as also residential treatment. This, I believe, is the second inflection point within the system. Youth who are able to successfully move through the system, okay? Once the tough and difficult decision to enter the system for the safety and well-being of that youth, moving through the system is paramount. There is an essential pathway to achieve permanency. If a youth ages out in the system, that means that they do not achieve permanency. There's a lifetime societal cost, get this, of $627,000. And and what we're looking at and what we're experiencing within the foster care services is we're seeing that a greater mental and behavioral health needs, which require a higher designation of care and higher costs. To support that, let me first start by looking below that in the CCI, Child Care Residential Treatment Program box. Within that box, there's a wide array of treatment programs for residential treatment. A continuum, if you will, within residential treatment, which is within the larger system of care within the child welfare continuum. So in 2018, 50% of our youth in that residential treatment program, residential treatment services box, were in the least restrictive. That would be the far right of that box. And in FY23, that type of care represented 17%. So in just 5 years, the acuity of those of youth in the program went from 50% to be least restrictive to 17%, a 33% drop or 33% increase in the acuity of care that we were seeing within residential treatment. This is at the same time, residential treatment was going through a reduction in available beds. In December of 2020, okay, remember the start of COVID? December of 2020, we had over 1,200 youth in residential treatment, CCIs. Today, that number, as you saw from Representative Demetrius, Director Demetrius' report, is that number is over 400. That's 400 less than the national average at 9% of youth needing care within residential treatment. And I believe in part there's a lot of things to this complicated question answer, but we know we saw 16 CCI licensed CCIs close their doors during COVID. Although we've seen some good progress, capacity is increasing in that area. The waiting list, as testified and represented, continues to be a concern for residential treatment. The increased need for higher acuity services within residential treatment, combined with the capacity concern, taxes and already stretched resources of foster care. You see the lines going up and down between CCIs and foster care. And that's because there's no other place for these kids to go. Because residential treatment is utilizing available beds for higher acuity needs, foster care is left serving youth who just a few years ago were being served by a qualified residential treatment program with 24/7 clinical care and 24/7 nursing care. So the foster care trend as a result is from 2018 to 2023, we saw a 9% increase in the severity of needs of the kids in foster care. And the highest proportion of that was in the level 4 designation of care, which is the highest designation within the foster care system. So foster care and child care institutions are necessary services to help stabilize youth, cope with their trauma, but more importantly, move successfully through the system to reach permanency. So the recent trends show that the programs, the majority of which are provided by private nonprofit agencies, are caring for an increasingly higher level of mental and health needs. So with that, I want to thank you, and I'll turn it over to my colleague from DA Blodgett, Mary.
Thanks, Dan. Good morning. I believe it's still morning here. Good morning, committee. Thank you so much for hearing us today and spending time with us. I am pleased to be here with you today. My name is Mary Mullett. I'm the CEO and president at DA Blodgett St. John's. We at DABSJ impact over 14,000 lives annually in a full continuum of care, the continuum you just heard Dan speak about, preservation, behavioral health, foster care, adoption, post-adoption services, and residential treatment. We're here today to help link together what is this child welfare continuum, and I'm so grateful to follow our colleagues from the department and their presentation to the committee, because I think all of this starts to come together and we understand the critical time we're in a system reform for children. So foster care case management is what I want to talk to you about a bit today. Case managers touch many parts of the, system that Dan just mentioned. Our case managers follow our kids. They do many things to coordinate that care. And our system has shifted. You heard Dan talk about the severity increase since the pandemic. I think we're still feeling and seeing what the pandemic will be for our communities going forward, and that's no difference in our child welfare system, where kids' needs are critical. I mentioned to Director Starling before I even came up here that I was going to mention our system was not set up for the severity of youth coming into care being 100% that level of need. And so our system, the department is working tirelessly and working to partner with private agencies, and we're all in to reform the system that we have, because today there's a bottleneck. You heard that a bit from Dan's presentation, and our youth coming into our care are higher needs in all levels of our system. So some of the innovative ways the department outlined earlier, I'm just grateful to hear. Hearing all that, I have a child's story to share. So one of our kids in our foster care program at D.A. Blodgett St. John's was struggling in multiple foster homes. She, because of the chronic trauma she'd experienced, attachments were very difficult, and she was in community homes, in our foster homes. Relatives, I believe she might have had a relative placement that didn't go well, that was disrupted. Her needs were greater than the relative could support. Went into foster homes and broke placement in foster homes. We lost community homes because they were so stressed trying to support this child. This is happening across the state. This is not a one-off at just our organization. Our kids that are going into our homes in the community today, their needs are higher and greater. And so we need to circle around those homes and those children and bolster them. We need support in those homes. I loved that enhanced foster care was up on the department slide. We need that kind of model to really support our foster homes who are trying to be unconditional loving homes for children, while we can bring children back to their parents and reunify when parents can break the barriers down. This child almost slept in our office. I'm grateful to say one of our foster homes came forward for us and helped her out. She did end up in residential treatment. And so she's doing well there, and that's great. However, it took multiple placements to get to that point. We really need to, as a system, front load our kids that are coming into care with services and supports to meet the needs they're presenting on the way in, so that we don't have that many disrupted placements. So, to wrap this up, because I want to pass it to my colleague here, the level of need of each child in care that they're presenting, it just presents a strain on our organizations providing foster care and providing all of the services in the child welfare continuum. We talked about earlier the workforce crisis that is real in our work. Our case managers are a critical role, again, touching all of these boxes in this presentation. And all of us in this work have increased compensation over the last few years to try to bring talent and retain talent for our kids in that role. Liability insurance, medical benefits, et cetera. I could go on and on about the increases to our costs. So today, we're really here to talk to you about investing in our child welfare system, investing in our foster care workers, and helping us help kids. In a partnership with the department, I think we could get this right if the resources were available to all of us. So, appreciating that partnership, really wanting to work towards fixing our system, which was not set up for the kids we're serving today. And I will not keep going on, and I will instead pass it to Rachel Sykes, my colleague, who will speak to you a little bit more.
Good morning, I'm Rachel Sykes. I am an Executive Director of Legacy Adoption Services underneath Samaritas. Samaritas is one of the largest providers of many of the programs that are on your chart today. And so I'm here to help bring additional understanding to some of the numbers that you've heard a little bit about with Dan and Mary. And so what I want to tell you is there has really been a sharp rise in cost for particularly foster care. So right in the very middle of the map that you're seeing is the foster care service and those case managers that are coordinating all of the things around them. You're looking at orange, the color orange on there for private agency actions, and if you follow that chart, you cannot get to permanency while really almost cannot get to permanency without the work that we're doing as private agencies. So we are lifting, we're doing a big lift to make sure that core piece is in place to move kids around this system in the best way possible. So our private agencies were central to this pathway of permanency, as Dan explained. We believe in the mission to serve children and families in these circumstances, and we're choosing to be a part of the healing and growing of our communities, attending to these needs so we can strengthen these kids and families. We can leverage connection to community, to your point, Representative O'Neill. We are the boots on the ground. We can relay the needs, we can garner the support and gather the people around this mission. We have the ability to build out local networks of community supports and resources because we can procure outside funding and philanthropic means in order to do that. So we have a unique ability as a private agency to do that community connection, and that is part of what we bring to that map. So private agencies were highly supportive of the necessary system overhaul that you're hearing about, and we remain very strong, present partners with the department, sometimes to our own detriment. So as private agencies, we are able to be flexible, we're early innovators, and we're purposeful in building these pathways to streamline service delivery. Our ability to achieve outcomes impacts Michigan's overall success in this service delivery, but financial pressures on our private agencies are threatening our ability to continue to do this work. Some of the starting point, the general history just in the last few years, and we know historically, we have been dealing with inequity in wages between the department and foster care wage ability for private agencies. So, for example, the department is able to offer a $23 an hour base rate, and private agencies on average can only offer about $18.50. So immediately we have a 20% inequity situation that's happening. These are known factors. And then private agencies are covering about 55% of all of the foster care cases. That's our color orange on there. So we are doing the majority of that lift in foster care. The contract reimbursements do not cover all the costs that are incurred by our agencies to provide full service delivery. So again, we know we're going to the community. We're using that philanthropic effort to go to the community to bring in supports in order to bolster that. These are known things that we've already been doing. But when we've had a major shift in the recent couple of years with some of the system overhaul that have created somewhat of a perfect storm for all of us, we've had a recent rapid action to do the system overhaul. This is supported by us. This is supported by us as partners, and we want Michigan children to be safe, and we want them to be in their homes with their families. So we support that. There's a 27% volume drop that has occurred in foster care over the last 4 years since 2020. We went from 13,000 kids to about 10,000 kids right now. So there's a 27% drop, and we adjust to that, okay? Because we know that it's good to get kids out of foster care. We're good with that. But this is a time when children and families need us the most. There's a spike in mental health, housing crisis, insufficient resources, unprecedented lack of affordable daycare, and exacerbated pressures on families that with low income below the poverty line. It's a time of insurmountable inflation in the last 3 years, anywhere from 6.8% in 2021, 9.1% in 2022, and we're still hitting 6% in 2023. That inflation is being experienced by all of our families, by these families, and by our workforce. And then include the residential treatment overhaul that has been occurring that we've been talking about. Again, we're very supportive of that. We went from 1,200 children in residential care to 450 children, made those adjustments. That's a 63% drop. And so like Dan and Mary were describing, a 27% drop in the total volume and a 63% drop in that residential treatment piece. We are continuing to be compromised while we're working on solutions. Foster care is handling the kids that are in that gap. So that acuity in care and that level of difficulty has significantly gone up with the kids that we're serving. So this is adding significant strain to meet these higher needs, and foster homes are responding. Foster homes are responding by exiting the system. Yeah. So they're closing licenses at unprecedented rates. And thank you to those of you on the committee. You provided an 8% increase last year in fiscal year 24. You provided funding for respite because you need something needed to be done to help these foster families to stay in place. But their response is to exit. We are trying to keep them in. Private agencies are hit hard because in order to do that, we have to increase our costs to retain, recruit, train, and support these licensed families to assist them with these higher needs kids and get them to do this with courage. We need them, and we need them to do it with courage. And then add in our staff now are exiting at alarming rates because of this pressure. The strain to manage elevated workloads without fairly addressing compensation began driving our social workers out of the field entirely. Healthy turnover for a social work program is between 15 and 20%. We know staff move around the system, but they're exiting the system entirely, and private agencies are experiencing a turnover rate of 60 to 90%. The department has been able to dial theirs down to 26.8% in 2023 with the ability to do mass hiring efforts. For private agencies, we are in crisis. We don't have the funding to do the mass hiring efforts and all of the additional training and preparation. So exiting staff and caregivers that are declining to take these kids with the higher needs is resulting in placement instability that Mary was indicating in her story. Placement instability is an issue. We cannot continue to have children who are lingering in care. So now, here we are, foster care services are asked to do more. As the reimbursement gap widens, we have not received an increase in this service line. It will be 3 years. So we're trying to manage all of these additional changes with 0% increase on the contract in these 3 years with all of that perfect storm occurring. So whereas the legislative attention has been given to caregivers, thank you for attending to these caregivers. Again, that foster care admin rate is stagnant for 3 years. So the added pressure to foster care case managers in this crisis has also not been addressed. Social work staff are required to respond to these heightened needs. There's a demanding pace and workload. They're undergoing more stress, unpredictable hours, and increased incidences of secondary trauma leading to high burnout. Agencies do not have those necessary funds to afford even annual wage increases at this point. So staff caring for the state's most vulnerable children are asked to work for wages at the same level or lower than most fast food chains or unskilled jobs. And agency expenses that are unfunded and also just the regular agency expenses are going up. Remember that inflation factor. So with each case manager exit, that impacts our permanency rate, but it also results in a loss of over $54,000. Each exit of a social worker caring for this kid costs our agency $54,000 to replace them and get kids back up and running with a case manager. We also do not have a cost of living adjustment in our contracts, so we're instantly year to year have less that we're able to provide regarding any increases that we might occur. Our liability insurance is a big factor that I want to present to all of you too, where we're seeing a 5 to 10% increase in liability insurance costs, and some providers do not want to engage in the risk that these programs have. There's damages that are occurring, there's other things they don't want to get involved in with the high acuity issues that are happening. And then we've got increases in all kinds of categories: transportation, benefits, just the reporting and compliance requirements that we're under, technology costs, being able to do the training that we need to do that is now required by the state for our staff to continue to gain competency, and anything that we need to add to these programs. So, starting to wrap up here, kind of where we are with a turning point is we're really focused on outcomes. We're partnering for these outcomes, and we really believe that the system overhaul is good, and we've got an unwavering commitment to make sure that these outcomes are good for children and families, just like many of you said in your questions back to the department. So our outcomes are federally tied to funding, right? So if we can't get the outcomes, that's going to impact our federal funding. They're tied to those lifetime costs that Dan brought up. And some of our outcomes, they're tied to this MySUP exit. So you heard about the MySUP exit, Demetrius, had explained to you from the department, and the idea of getting that $10 million investment for those needs to continue to get out of that. Right now, we want to get out of the MySUP too. So it's a huge pressure on the private agencies. We've spent hundreds of hours on committees, task force, with MDHHS leadership and meetings, organizing around the regulations and meeting the demand to update our own systems and technology so that we can gather data and prove our work to get out. none of which for private agencies has been cost reimbursed. And all the while, we're watching while the state is having to pay upwards of $20 million a year because of the litigation and the costs related to this MySUP. We want out badly. So what we want to ask you, though, today is to consider, we're grateful for the supports that you bring to caregivers, for the supports to the 447 juvenile justice kids, 221 of which are dual wards in foster care. So half of the juvenile justice program is foster care children also. So what we need to ask you today is to take high consideration to bridging the gap for the reimbursement cost to deliver these quality services. The gap is big. The gap is big with no funding coming to us for 3 years. So we're asking you for a 25% increase to help with this rate. The number of kids will go down. There's some cost containment that can happen there, but we need that increase in order to do the level of work that needs to be done to get that core piece stabilized on the map that you have. And that is an increase of $13.80 a day for our daily rate. That's what we're asking for. If we can get that, we know that we can stabilize this crucial central part of this continuum, and that we will be able to have ROI where we can take our focus off this crisis and continue to build with the department on the innovations that need to happen to get us to the next step. And ultimately, this is for our kids. These are our Michigan kids. Honestly, these are your kids. They're wards of the state. You're the parents. Mm-hmm. So we want the best for them. We're all here for them. We want them to be able to be with their families, and we want them to be okay. So thank you for your time today, and thank you for all that you're doing to support our work.
Thank you all for your presentation today. I'm going to allow one question because we have one more presenter, Rep. Meerman.
Thank you, Chair Morris. Appreciate I just want to start out by saying thank you so much for your heart in all of this. Director Starling as well, thank you. This is, I think we're measured as a community how we do with these kids. My question, and maybe it's a little more involved than we have time for, but is how does the mental health help arrive to these kids? And let's just assume that they're coming into foster care for the first time, ignoring the idea that we're trying to get them help before at their families. But let's just assume they come in as a call from the police, you know, they're getting separated from their family. How does that help the mental health help arrive, and how long might that take?
Thank you, Rep. Meerman, and thank you for your advocacy for children. I love your engagement with all the presentations that I've had in front of you over the last few years. The mental health connection for our kids that come into foster care, that is, again, a case manager job, right? They're connecting our kids and our parents to resources in the mental health field. So I believe you're hearing from behavioral health here coming soon, just after us. And so, again, if you look at your chart, that foster care case manager, they're at the middle of all of that for our kids in care. And so that's really what we're talking about today. That part of our system, to bolster that component to the system, will help in all of these touch points we have with families and children, with an effort to reunify whenever possible. And so that mental health connection also for the parents is happening through the case manager. Does that answer your question? Thank you very much.
Rep. Price, if you want to ask your question quickly.
Thank you. Thank you for being here today. My question is about retention and recruitment of your workforce. Clearly, it's a huge problem here and in many other areas. But we heard from the department and some of the efforts and initiatives and things that they're doing to work on workforce recruitment and retention. In your opinion, what are they missing? What can we do? Best practices from other states, from other agencies in other parts of the country? What are other groups doing, other states doing to support the groups that could help you meet those needs?
So one of the more immediate things is the equity in the wages would be helpful. So 20% less with a private agency than currently with the department does make a difference when people are selecting the jobs that they want to stay in. But if we can get those rates up a little bit, we can at least get the right people into the jobs to get involved in this mission, and when they're in the mission, they're going to want to continue. If we can support them and make the system work the way that it needs to work, where we're not burning them out. So it's really about being able to get that right number on the wages to keep people engaged into it. We need to also provide the training where these case managers can feel competent and confident and that they're doing the mission, because they're leaving, less than a year of their time in, and they're like, I can't do this. This is too hard. So it's really helping support them in training, getting those wages up, and creating a culture around this mission where they want to stay and make it work for Michigan kids. Right, thank you.
Rep Price, I would just come in alongside Rachel and say that's exactly why we're here today. That 25% increase does all of that. It opens the door for all of us to be able to really invest in our workforce, and now's the time we really need to invest to bolster our system. So thanks for the question.
Well, thank you all for being here. We appreciate your presentations. We're going to move on to Connie Conklin, who's CEO of Livingston County CMH, to talk to us about the behavioral aspect and resources for the children in our child care system. Welcome. You just have to turn on the mic there if you see the mic button.
All right. Well, I have to do a shout out to Representative Bolin. Thank you. So I'm Connie Conklin. I'm the Executive Director of Livingston County Community Mental Health. I've worked in the public system for 37 years at both a local and a state level, mostly in children's services. And I think some of the most important things that as a CMH, I believe that we do and should support kids in foster care, kids in child welfare, kids in schools, kids in everywhere. There are community kids, and we need to figure out ways to serve them. And we also do serve kids in foster care. I know that there's some concern around access, and I'll talk a little bit about some of the challenges with regard to that. I think the big thing is we need to work together collaboratively and do whatever it takes. And I think, we worked really hard to create a system of care for kids. And I think for a variety of reasons, I think we've taken some steps back from that. And I think we need to get back to those core values around these are our kids. You got something, we got something, all the systems have something. How do we pull it together to make some sense to support kids creatively? I think children's and youth needs are universal. I think the circumstances of kids in child welfare are different. They're definitely different. But I think we really need to get back to the fundamentals of all kids have needs. All kids don't have services. And I think we need to take a step back and say, what do these kids need and what are we going to do about it? Versus that there's some magical service that we're going to put a child in and have it work. It's too serious and kids are too vulnerable to put all of our eggs in that a service is going to make the biggest difference. It's looking at the combination of needs. It's supporting the caregivers. It's supporting the workers, everybody in that process. We need to really focus around safety, security, and a sense of belonging for kids. We need to find strategies to recommit to the unconditional commitment philosophy, that we don't move a kid's address, that we figure out what's it going to take to keep them there. And whether that's their family home, and sometimes it's not safe, and so they do go into foster care, they go into kinship care, but then how are we going to keep them there? Every transition that a child has a negative impact and traumatizes them. Every therapist that they have that changes over time, turnover impacts, caseworker impact, they have to start over. That is traumatizing to both the child and the family. And so systemically, we really have to look at that and view kids in that way. I listened to some of the kinship care and some of the things that Demetrius talked about, which I think is great, because I do think we have to expand the support for grandparents that are raising grandchildren and those, all the kinship care and foster care, because I think that's really where we're going to get positive outcomes. I think the challenges in our system right now, and everybody's talked about it, is the workforce.
I can't do more when I've had in the last 8 months, 7 of my master's level clinicians leave for the schools. I know that there's needs in the schools. I appreciate that, but kids leave the schools too. And we have to make sure we're supporting all the efforts. And so it's not a criticism of investing in schools, but it's a really, there's some unintended consequences, I think, with some of that we need to work collaboratively and have more of those efforts that kind of get the best of all of our systems and kind of push our systems to figure out ways. So, and I haven't lost them necessarily to our local intermediate school districts or schools. It's been more of surrounding counties, but because we work collaboratively with our school systems around some of that. When the workforce feels like they're making a difference, they're going to stay. When system barriers and administrative burdens are overwhelming, they're going to leave. And I do exit interviews with everyone, and those are some of the things that challenge us, is that we have a lot of layers of administrative and regulations. Some of the barriers around access of serving kids in foster care really have to do with sometimes kids are coming from out of county. So when we're working with our private agencies and our DHS within our counties, we're able to figure it out and get the authorizations, access to services. But we have a lot of kids that are coming from out of county, and there's some real barriers around getting authorizations if parents still have parental rights to get access to those services and all the authorizations and those kinds of things. You know, I think the other thing that concerns me is children in foster care have experienced a level of trauma just by the nature of being removed from their homes. That doesn't necessarily mean that kids have a mental health diagnosis. That doesn't mean that we don't have a role in supporting them. But I think I worry about the story that we're creating for some of these kids and creating a pathology aspect or a door versus they have needs. Every kids have needs. If you have children, you know that they have needs. We have to, again, address those needs and not just think that the services are going to be the big component of that. It's around foster parents having respite. It's around workers staying in their jobs and keeping the consistency. And there's research out there around the impact of turnover on permanency. It's significant. And again, it breaks my heart every time a therapist leaves because I know there's a bunch of kids that have to start over, and that's not fair. So some key priorities that I would say around this is finding ways, and I appreciate some of the investment that has already been made in behavioral health workforce because those efforts are helping. Some of the scholarships loan repayment where we have staff, I just signed off on 2 of them yesterday, where staff are actually, if they commit to our agency for 2 years, they're going to get some of that loan repayment. Those make a difference to people. The salaries do, obviously, but I think some of those other incentives are important as well. I think the other thing around the social workers that I just have to say, because I know there's legislation out there, is the licensing, the testing is a barrier. We've lost some great social workers who just got frustrated with the test and left the field. I think supporting the supporters around foster parents and having that same support around kinship care is important. Supporting the expansion of the CCBHCs because I think that's only going to open the door wider for kids in child welfare. Investing in collaborative efforts and really thinking about the implications of, again, the workforce when we're infusing, whether it's the CMH system, the child welfare system, the school system, without some kind of sidebars around us working together. So an isolation of each other, because we're pulling from the same workforce. And so if the schools pull from the CMH, that's going to impact the CMH able to serve the kids in the school and somewhere else. And again, some of that's the nature of what happens, but I think
doing things collaboratively. Like, so in our county, I've talked to the schools and said, hey, we're going to do mobile crisis together because we have a workforce issue, and we're going to have to just pull everybody together in order to get this done. And then I think the other thing is reducing the administrative burden and compliance. Invest in accountability and impact, identify the outcomes you want, put some sidebars on how to do it, and then let the local agencies and communities figure out how to meet them. We're all different. The outcomes and expectations shouldn't be. So really focusing on more innovation, partnership versus compliance. I can comply to things and check the boxes and fill out the forms, but if I'm not keeping kids safe, if I'm not providing a service, that's probably not what you're most worried about. And so really focusing on those kinds of things. Thanks for your time.
Thank you so much, Director. Do we have any questions? Rep. Boland?
Thank you very much, and it's great to have Connie here. She does a great job in our county. And one thing we do really well in Livingston County is collaboration and working well. And so is there something in particular that we do, and we know we have a growing need and demand, but that we might implement elsewhere to help other people move along?
Well, I think one thing that's unique is we do have blended funding. So we have funding that has, there's an allocation from the county child care funds, from the child welfare component of it, the juvenile justice, mental health, the intermediate school district. So when kids don't fit in the box, they may have private insurance, but they're involved in the court system, we can serve them because we have blended funding. We have a way that we're pulling from that. Not every county has that. So we've reduced some of the barriers because we've pooled our funding together. That, I think, is a model that is helpful to people and is something that we're doing. And again, I think we're looking at doing our mobile crisis collectively because we just, one, we may not have as big of a need around some of that, but the other piece of it is it's a workforce. You know, some of the innovation, some of the projects that have expanded are great, but having the ability and the workforce to do that kind of expansion is difficult, and it's difficult for all of us. So then we don't deliver on what we need to.
Thank you so much. Thank you for being here. Thank you for sharing what we need to improve on and where the issues are. That, you know, that's really what we're here for, is to figure out where the highest needs are and where we need to invest our all-important tax dollars. So thank you to everyone who presented before the committee today. If members have any follow-up questions, we're happy to send them on to the people that you would like answers from. And Vice Chair Murtis moves to excuse absent members. Hearing no objection, absent members are excused. And seeing no further business, this meeting is adjourned.